21. Which sign is a classic symptom of pulmonary embolism? A. Bradycardia. B. Sudden chest pain and dyspnea. C. Productive cough with green sputum. D. Inspiratory stridor. Rationale: a sudden onset of dyspnea and chest pain is characteristic of PE due to blocked pulmonary circulation. 22. The client with COPD should be taught a. Increase oxygen flow above 5 liters per minute. B. Use pursed lip breathing. C. Avoid all physical activity. D. Take antitussives daily. Rationale: pursed lip breathing helps maintain airway pressure and prevents airway collapse. 23. A nurse is caring for a patient with pneumonia. Which is the priority nursing diagnosis? A. Activity intolerance. B. Impaired gas exchange. C. Deficient fluid volume. D. Risk for infection. Rationale: gas exchange is directly impaired due to alveolar inflammation in pneumonia. 24. What action should the nurse take for a client with a chest tube and continuous bubbling in the water seal chamber? A. Clamp the tube. B. Reposition the client. C. Check for air leak. D. Notify the provider immediately. Rationale: continuous bubbling may indicate an air leak and needs assessment. 25. A client with asthma is experiencing wheezing and shortness of breath. Which medication should the nurse give first? A. Montelukast. B. Albuterol. C. Fluticasone. D. Prednisone. Rationale: albuterol is a short-acting bronchodilator and the first-line rescue inhaler. 26. In a client with tuberculosis, which finding supports effective therapy? At night sweats persist. B. Hemoptysis increases. C. Weight loss continues. D. Sputum cultures are negative. Rationale: negative sputum culture confirms reduction of infectious bacilli. 27. What is the purpose of the incentive spirometer? A. Prevent asthma attacks. B. Reduce respiratory rate. C. Prevent atelectasis. D. Stimulate coughing. Rationale: it encourages deep breathing to expand alveoli and prevent collapse. 28. A client is receiving oxygen via nasal cannula. What is the maximum flow rate appropriate for this device? A. 4 liters per minute. B. 6 liters per minute. C. 8 liters per minute. D. 10 liters per minute.
Rationale: the nasal cannula delivers up to 6 liters per minute effectively.
29. Which position promotes optimal breathing in a client with pneumonia? A. Supine. B. A prone. C.
High Fowler's position.
D. The Trendelenburg. Rationale: high Fowler's maximizes lung expansion and oxygenation. 30. What is an early sign of hypoxia? A. Cyanosis. B. Restlessness. C. Bradycardia. D. Confusion. Rationale: restlessness and anxiety are early signs due to inadequate oxygen delivery.
31. A client with a tracheostomy develops sudden difficulty breathing.
What is the nurse's first action? A. Suction the tracheostomy. B. Notify the provider. C. Assess airway patency. D. Remove the trach tube. Rationale: always assess airway patency first before intervening. 32. A nurse prepares to suction a tracheostomy. What is the priority action? A. Use clean gloves. B. Pre-oxygenate the client. C. Insert the catheter without gloves. D. Suction for 30 seconds. Rationale: pre-oxygenation prevents hypoxia during suctioning. 33. A client post-thoracentesis reports dyspnea and asymmetric chest expansion. What complication does the nurse suspect? A. Pulmonary embolism. B. Hemothorax. C. Pneumothorax. D. Pleural effusion. Rationale: sudden dyspnea and asymmetry suggest lung collapse from air in the pleural space. 34. In COPD, which blood gas abnormality is expected? A. Respiratory alkalosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Metabolic acidosis. Rationale: CO2 retention leads to respiratory acidosis in COPD patients. 35. Which of the following is a priority goal for a client with asthma? A. Increase physical activity. B. Reduce food intake. C. Maintain a patent airway. D. Improve skin integrity.
Rationale: maintaining airway patency is always the top priority in respiratory conditions. 36. A client is receiving 50% oxygen via Venturi mask. Why is this device preferred? A. Less expensive. B. Allows humidification. C. Delivers precise oxygen concentration. D. Works without electricity.
Rationale: the Venturi mask provides a controlled, fixed oxygen concentration, ideal for COPD. 37. After bronchoscopy, the client reports sore throat and coughs up blood-tinged sputum. What should the nurse do? A. Monitor closely, this is expected. B. Call the provider immediately. C. Offer antibiotics. D. Give an expectorant. Rationale: minor bleeding and sore throat are expected post-procedure. 38. A client with pneumonia has a respiratory rate of 32 per minute and O2 sat of 88%. What is the nurse's first action? A. Increase fluid intake. B. Apply oxygen. C. Elevate head of bed. D. Notify the provider. Rationale: hypoxia must be corrected promptly with supplemental oxygen. 39. A client develops a tension pneumothorax. What sign is most concerning? A. Absent breath sounds. B. Chest pain. C. Shortness of breath. D. Tracheal deviation. Rationale: tracheal deviation indicates a life-threatening shift of mediastinal structures. 40. Which diagnostic test confirms a diagnosis of tuberculosis? A. Chest X-ray. B. PPD test. C. Sputum culture for acid-fast bacilli. D. White blood cell count.
Rationale: the only definitive diagnosis of active TB is through AFB positive sputum cultures.